Welcome back to Inside. I'm here with Dr. Luga from Fort Wayne Oral Maxilla. See, every time I do it, Maxillofacial Surgery and Implant Center. I was close that time.
Yes, Fort Wayne Oral Surgery.
That's easier. Fort Wayne Oral Surgery. I like that. We're going to talk today about jaw surgery. Now, there is a fancy word for that. You say it.
Orthognathic jaw surgery or corrective jaw surgery.
Okay, so corrective jaw surgery. Tell me what it is.
This is a surgery that's usually done by oral maxillofacial surgeons like myself, and it aims to realign your jaw, your teeth, and improve your function and aesthetics. And you'll see that the patient's appearance becomes really good. And by the function, I mean chewing becomes better, breathing becomes better, speech becomes better.
I guess I think about chewing. You think about speech. I never thought about how jaw misplacement might mess up your breathing.
Oh yeah, so when we move your jaw forward, it actually helps you breathe. We see a lot of patients with obstructive sleep apnea, and we do this for them.
So does it hurt?
No, it does not.
You would not.
You always ask that question.
I do. I'm kind
It's
of.
done under general anesthesia in a hospital. You're fully asleep. So no pain during surgery. Now afterwards, little aches, and I will give you some pain meds for that.
Thank heavens. You got to take care of me. So what age? Like, would I have it done when I'm younger as a child? When I'm at a little older age like myself, is it okay?
Good question, because I get a lot of patients asking that question. So females, we want to do this when you're done growing. So females, anywhere between 16 to 18. Males, 17 to 20.
So how much is it going to cost me?
A little bit.
More than $5.
It ranges. The costs range between $25,000 and $35,000.
I would assume that my insurance can help me out some with that too.
If it can be documented that the problem is functional, most insurance would cover it. If, of course, there's a caveat, there's no exclusion in your plan.
Right. There's always that little caveat. So why the wide range in that cost?
Well, there's a lot of reasons, but three main ones: surgeon's experience, technique used, and of course where you live, your geographic location, which state. So the price would vary because of that.
So give me some of the risks if I'm going to have this jaw surgery. What are some of the risks?
Like any other surgery, bleeding, infection, numbness to the lower lip and the chin. You may need future surgeries to correct. Yeah, things like that.
So let's talk about the numbness to the jaw.
Right.
That'd be kind of weird, wouldn't it?
It is. Now, the upper lip actually resolves very quickly.
Okay.
But the lower lip could last a few months, and on a few occasions it could be permanent, but most patients, they will still look normal. This is something that you would know, and it's on rare occasion.
So am I going to need braces then?
Yes, absolutely. You would need braces or aligners. So I normally would work with orthodontists, and I work with all the orthodontists here in town and around in Illinois, Ohio, Michigan. I have some patients coming from, actually I have some patients from Georgia. Yeah.
You're a popular guy. So how am I going to know if I need jaw surgery?
Oh gosh. Here are the main reasons you may know. The main reasons you'd come to see me or any other oral surgeon for jaw surgery. One, frequent jaw pain, joint or temporomandibular joint pain and headaches, trouble biting, chewing, or swallowing your foods, snoring or what we call obstructive sleep apnea, an open bite, that is the gap between the top and bottom teeth when your mouth is closed. If you have a receding lower jaw or chin, what we call an overbite, or you have your protruding lower jaw or chin, what we call an underbite. Of course, in addition to impaired function. And also a history of like facial injury or a congenital malformation such as cleft lip and palate. All these could be reasons that you may need jaw surgery.
I would think some of those, somebody else is going to refer you. Orthodontist or somebody's going to refer you.
Yes.
So let's talk about, real quickly, virtual surgical planning.
Oh, this is the new thing. That's what I do.
Yeah. You like the new thing.
Of course. Virtual surgical planning. Essentially, a patient comes in. We take clinical photos, CT scan, intraoral scan. We upload everything on the computer. I plan the whole thing on the computer. I'm able to show you the before and after. I share it with your orthodontist. So we make all this together. The surgery is easier, much more predictable, less painful. It's just like having your robotic surgery when you're having all the other surgeries.
I love the high tech. Well, if
Yes.
you need this jaw surgery, please reach out to Fort Wayne Oral Surgery today. We'll be right back.